talking about rehousing and separations today. Myself, Stephanie Therrell, I'm one of the supportive housing managers here at Alliance, and Cliff Guida, my peer supportive housing manager in the home region, are going to be your co-facilitators today. And we'll go to the next slide. All right, so just a little bit about Alliance. We are the behavioral health managed care organization for Cumberland, Durham, Harnett, Johnston, Mecklenburg, Orange, and Wake counties. We are currently serving over 200,000 Medicaid members with a total population of 1.7 million. We operate under the Medicaid 1915 BC waivers. All right, so before we start talking about rehousing, we want to talk about kind of what happens in that initial process or before we even get to the rehousing point. So generally speaking, with rehousing, we are addressing a concern or issue that a member is having in tenancy and looking for a new unit or home for that member. But before we get there, we want to make sure that we attempt to resolve any issues and preserve tenancy through an executed action plan. This might involve case staffing or an intervention strategy. We want to make sure we're having conversations with the landlord, provider, and the member's care team to discuss those issues or concerns and what the plan for addressing may be. If it's a payment issue, we want to talk about leveraging any community resources, applying for our internal funding stream, ILI, or the Independent Living Initiative Fund. Also discussing with member any budgeting skills or implementing a payee. A great support that we've recently implemented here at Alliance is we now have the tenancy preservation team. So making sure that we have made a referral to tenancy preservation, that we have also considered community inclusion to get that member more involved in their community and surroundings, and that we have considered a reasonable accommodation if appropriate. So if you are not familiar with a reasonable accommodation, it is kind of a letter of support that can speak to specific concerns or additional accommodations or needs that a member may have related to their disability. And then we might also want to discuss increased supports or services that the member and the provider can receive. So if a member's, getting peer support, maybe they need to bump up to CST or ACT, or maybe we need to increase the frequency. If they're only getting it once a month, maybe we need to start going, twice a month or every week, or even multiple times a week. We additionally want to have an honest conversation about what is involved with rehousing. So rehousing can be a lengthy process, and so we want to be honest about the length of time for rehousing. Even you and I, if we wanted to move, we couldn't do that tomorrow, right? So we need to be honest about the time that it takes to create a plan for rehousing, to identify a unit, to have that new inspection, and all the parts of the process that need to be executed before a member can move. And a part of that conversation should include the availability of alternative housing like bridge or CTRP programs. It might also be living with natural supports, shelters, detox programs, inpatient resources, other types of transitional housing programs, because bridge and hoteling may not always be an option or may not always be something that is approved. Additionally, there are costs associated with rehousing. So making sure that we are having that conversation with member about what it costs to store items, hiring movers, moving, or even purchasing new items needed. And we do have our TYSR funds that we're going to talk about here in a little bit. But if those are not available or approved, or if that fund has been depleted, we want to make sure we have an action plan for how to address those costs. Another thing that can be considered with this is also just like application fees for new units. Although a member...
The slide isn't moving, Stephanie?
I'm still on it.
Oh, okay. Okay. Gotcha.
Thanks, Cliff.
Gotcha. I thought we
Just
were
a
going
little
in
more.
the
I
other
know this
part.
is a lot. There are a lot of words on this slide.
Right.
But additionally, we want to make sure that we're planning a thoughtful move and rehousing process with a step-by-step action plan with the member. So, although a member may be extremely anxious to move quickly or really, willing to kind of take whatever new housing is available, that usually changes once they're in that housing. Then we start hearing things, like, I actually needed a first floor unit. I needed something that, had an accessible shower. So we want to make sure we're having those conversations before the member moves into their new unit, and that new unit is going to address every need they have. Because what we don't want to do is just have them move into a unit just to go ahead and move. And then we find out that unit doesn't meet their needs. Before rehousing too, we want to negotiate any alternatives to eviction. We might talk to the landlord about non-renewal of lease, early termination of lease with no financial penalties, relocating a member to an alternative housing location that's managed by the same property manager or landlord, and really just exploring kind of every option on the table before we take those steps towards rehousing. All right, now we can go to the next slide, Cliff. All right, so it's time to rehouse. What are some of the reasons that we would like to move forward with rehousing? So generally, we might see something that is a medical concern that needs to be addressed immediately. In these situations, we love to have supporting documentation from a doctor. So this might be that a member had a medical issue and they do really need that first floor unit. They can't walk upstairs anymore, or they can't rely on the elevator and need that ground floor. There might be a safety issue that cannot be addressed with conflict resolution skills, other interventions, or police involvement. It might be apartment break-ins, theft, documented violence, or targeting of that member. Again, supportive documentation is going to be a great bonus here for us to just really kind of, demonstrate the safety issue that the member is experiencing. So any police reports, other kinds of like documentation that a member may have. We've gotten videos from Ring doorbells before, or even just pictures of concerns. So anything that, can help demonstrate either the medical issue or the safety issue is going to be beneficial to that rehousing plan. And then other options may be that the landlord has refused to renew the release, even though there have been those multiple attempts by the provider, the member, and alliance to resolve the situation. The landlord is no longer an eligible vendor or provider of the housing unit. They sold the property, or the attempts to resolve the tenancy issue, including engagement of the tenancy preservation team and previous negotiations, have been unsuccessful. All right, so now we're getting to the point where we're ready to start preparing our rehousing plan and making sure we're, submitting a rehousing plan. So one of the biggest things is just answering all of the questions, completing the plan in its entirety with fully answered questions. Any plans that are submitted with incorrect member information or that are not fully completed will be returned. So just go ahead and save yourself and that member some time and make sure you review that plan and that it's fully completed with accurate information. It should also include a realistic and viable plan for how the tenancy issues or concerns will be addressed, or what the root cause is and how that root cause will be addressed ongoing. We should also, use this as an opportunity to talk with the member about the obstacles and barriers that may get in the way of them finding permanent housing. So if they've got extensive credit issues or a criminal history, any outstanding utility debt that would prevent them from, transferring utilities or setting up new utilities, the next unit needs to be addressed as a part of the rehousing plan. It should also include the frequency of supports and who is providing that support. So A provider should be involved and providing daily, weekly, or monthly support with those specific details as outlined in the plan. And as we kind of mentioned earlier, if there's the need for increased services, what would be the plan to implement those increased services? And if the member is not engaging, if they have kind of reached a stalling point or a plateau and they're not really involved in the plan or services, there should be some information about how we're going to engage that member included in the plan. If the issues are recurring, we want to see a history of what interventions have been previously attempted and any interventions that were previously successful in the plan. And this might include reviewing lease violations with the members, outlining what they're able to commit to going forward, or really, just any of the attempts and the outcomes that have been previously tried to address the issue. And then one of the big things here is if the member was in a targeted unit previously, we need to ensure that there's collaboration with Alliance, the supportive housing team, and DHHS regarding the concerns that were identified during the targeted unit tenancy. Because if the member does, want to go to a target unit going forward, DHHS can actually request an additional rehousing plan or a copy of the rehousing plan that's being completed for that member. So we want to make sure that there's definitely collaboration around those targeted unit specific issues so that they continue tenancy in one of our targeted units. And at this point, I was just getting ready to toss it to you, Cliff.
Sorry, I was just going to add to that. So even if they're coming from a private unit, but say 7 years ago they weren't targeted, that will come back, right? So if we're aware of that, we really want to check on that because we may approve on our end what we saw, but targeted will kick it back still because they'll have other issues. So we want to make sure someone was in a targeted unit that lost housing at any time. We want to find out what those issues were prior to the plan. So that'll help eliminate another plan being requested.
Thank you, Cliff. Yeah. So regardless of when that targeted tenancy is, if they're going for a targeted unit in the next unit, we need to have that collaboration and just be that awareness of the problems because DHHS will request any information. And then actually, Cliff, I'm gonna let you take it away and give us some friendly reminders on the next slide.
All right. Hello, everyone. So friendly reminders for rehousing, and this is important. So the rehousing plans must include all signatures of the member, the provider, if there is a guardian, when applicable, and the TCL care managers or transition coordinators. So all signatures have to be made and be submitted to your Alliance supervisor for their review and completeness prior to submitting to the supportive housing manager or who's covering that area. Also include the housing slot number and population category. And just an FYI, there's going to be a new rehousing plan that'll be coming out in the next 2 weeks, which will have some added pieces, which we didn't go into. But those will be out there, and it's going to be more informative, a little easier to track for you guys as well. Have full explanation of the root cause, root issues. So like, let's say a member hasn't paid rent. And so we'll see that on a plan, like rental debt didn't pay their rent.
Yeah.
So why didn't they pay their rent? Like what is going on, right? Like, because not paying the rent doesn't always address what's really going on with the member. Like what's happening. We really want to see that in the plans because we want people to maintain housing going forward. And just getting a payee doesn't mean that they're in a good place. Okay. Or the supports are needed for them. So we really want to dig into that. And we want to make sure that's on the plan. Formatted and scanned into the appropriate document. So one document in the PDF signature page should not be separated. Next slide. This is going to continue. Do not copy and paste. Ensure that information is detailed and this is person-centered. So you're discussing this with with the individual you're working with. Please do not copy and paste plan to plan. So we're not just pulling from PCPs. We want this addressed individually. Provider and or clinical support specialist is involved. So when we're doing a rehousing plan, our member needs to be connected with a provider or the clinic Alliance Clinical Supportive Housing Specialist. And at that point, if there's not a provider in there with the clinical supportive housing specialist, there's been one referred, and there's going to be an ongoing plan after that. So those will be the two. So we want to make sure those two things are in place for housing, because part of TCL is having individuals that has the supports needed to maintain housing. Notify subsidy housing teams of projected moves and keep both teams informed of members being rehoused in the process. So subsidy has paperwork that's going to be needed, and it's very, very, very important that they have all the paperwork needed. Inspections are completed prior to move-in, prior to lease signings. We don't want to move forward. We don't want people moving in and the process isn't completed appropriately. Ensure currently housed members. So if a member is currently housed that is looking to rehouse and they have an active lease, it has to coincide with when they're going to be rehoused. Unless there is a safety concern and an RA is needed to get someone out of a lease. But these are legal issues. Leases are legal, that the member is signing the leases. So they're obligated if they just leave the lease. So this is why you'll hear me say that the leases, they just signed a lease. So they can't just move with no apparent reason without there being some issues that they'd be obligated to. And then we can move forward with that as well. So we need to work with the property managers as well. Consider the request for reasonable accommodations in these situations. Next slide, and I think it goes back to you.
Sure does. Yeah. Thank you, Cliff. All right, so now we've got to the point where we've got an approved plan, which is very exciting, but we don't want the conversation to stop there. So when you've got an approved rehousing plan, submit referrals for several targeted and private units at least 45 days prior to the projected move. Do not wait to start the process. So go ahead and start having those conversations with members, start reviewing vacant units and talking about what those priorities are and what their needs are related to their next unit. Also, again, another opportunity to talk about the expenses related to moving and helping them develop a budget for the costs associated. So this could be rent, utility deposits, toiletries, any furnishings that may need to be replaced, or is this the point where we need to start exploring financial assistance through TYSR or community partners? We don't want to just rely on emergency funds or TYSR. We do want to explore all resources available to that member. And then you can also check with the housing team or review any tools provided by us that can help with identifying apartment communities, amenities, or other specific member needs. And then really kind of drilling down in those conversations with members about their feelings related to leaving their current situation or the transition process. They've developed probably some familiar routines, and change is difficult for all of us. So we need to be mindful of that as we're working through the rehousing process. We want to provide a safe place for members to discuss any fears that they have. about moving to an unknown unit or moving to that next unit where everyone and everything is new. And it's also a good opportunity to prepare for any decompensation or relapse due to the stress of moving. Moving is like extremely stressful. So I have it pretty much at the top of list of things I don't like to do. You got to do a lot of preparation. You got to pack a lot of boxes. There's a lot that goes into moving. And so we also want to make sure that we're being really mindful of like the stress that that can bring and how it can be a trigger for our members. Also, encourage them to, start to consider community inclusion for their new community. How do they want to get engaged in other activities in their upcoming area of residence? And anticipate the potential for them to sabotage or no show for an interview, to not complete paperwork, to not take the necessary steps to secure that housing because of some of these fears or anxieties that we've just discussed. All right, Cliff, you want to talk to us about denials?
Sure. My plan was deny common reasons for denial. So here's some reasons for denial. So if a member's identified needs, concerns required additional interventions, including. So let's say a member, there's some major risk factors that are identified in the plan, and there's concerns. So those should really, prior to even doing rehousing, we should be really looking at these. But if we didn't, and it gets caught by the supportive housing manager, so that may be a reason to being addressed with complex care consultation through Alliance, the reviewed medical team, and the high risk consultation team. And those are because we want to ensure our individuals are safe as well. So those may be a reason for a denial. So ensure all required information, including signatures and formatting, was completed. So we kind of went over that earlier. So just making sure everything's completed. Submit an updated plan responding to all areas identified needing more information. So if it's not detailed, it's going to go back. If everything's not addressed with the tenancy issues, if it's just a non-payment of rent and that's all it says, it's probably going to get sent back. And a lot of times we'll know what the issues were. So just be aware, and also like care management will know. If not, supportive housing specialist will know. Providers should know as well. Everyone should kind of know and have a feeling on what's going on with the member prior to being out of housing. Now, sometimes people come back that are like been out of services for 3 years. So maybe nobody knows, right? But we can look into that and find out that information to try to better support the member. But our members a lot of times are the first point. Like really talk to them, have them be honest, have them be opened up. If they're not able to do that, then we want to try to figure that out, to try to help them, maintain housing in the next housing. Submitted an update plan, or just went over that one, sorry. To may include specific to provider interventions, action plans, supportive provided, and frequency, details on previous concerns with interventions attempted and planned to address. It's kind of like what I was just talking about. So really going over what the reasoning is behind why the denial was. And a lot of times we'll provide some of that information if we're aware, if there is a denial. Anyone I know that's seen me and Stephanie with the denials, we'll put things on there. Some are very specific to the housing or the previous housing, and that can be with, at any timeline, because we will look at that as well. So support implementation or attempted medication compliance, payee assignments, or unidentified interventions. Let's say an individual was in housing and destabilized. if they're on medication now or doing something that made those changes, that's a good show of what has occurred. Other example is somebody was hospitalized, went to CRH for a while, was able to stabilize. So things that have been done after housing as well is really important in the plan. Like really addressing these issues and how they have overcome it. If somebody went to an Oxford house, for 6 months, that's great, right? Like those are things we want to see. Like what have they been doing to better help with this next to maintaining housing? Payee assignments, addressing those with individuals that aren't paying rents or maintaining bills. For some of the funds, those may be requested with their plans, i.e., ILI, other routes. And members' willingness to engage and complete the plan is identified. It's very hard to do if our member isn't working with providers or care management on how a plan can be done. So that'll go back to the question of stabilization. What is happening? How can we support this member to get connected to what needs to get towards that engagement? Next slide.
And I think this one's coming back to me just to talk about some of the challenges we have when members aren't engaged. So here are just a couple of examples of some motivational interviewing questions. Obviously, you don't want to take these to the member and ask them verbatim just this way. You might want to use your own phrasing, but there are a couple of questions that can help, really kind of identify, how we can get that member engaged, where they are in the process, what level of engagement they're currently at, can be using these questions. So any desire questions about what they want, what they would wish to happen, their ability, how confident are they that they can complete certain steps, going back to that action plan. It doesn't make sense to have a plan that the member can't actually complete or isn't committed to. So it really needs to be person-centered and driven by that member. And then also kind of maybe some reasoning questions. What would be the advantages of doing XYZ? Or what would be the advantages of rehousing in this specific community? Maybe it's near to a rec center or somewhere or a bus stop that they have specifically, utilized or needed before. And then need questions. What needs to happen specifically? So that's really kind of the bulk of the plan. So definitely just starting with some of those questions with your member. Another approach could be querying extremes. What concerns you most about your current behavior or current living situation? And if we make this change, what's the best thing that could happen out of that? Looking back or looking forward. So what were some things that maybe you've experienced before, and how have those things changed? Sometimes when we work with people who have had experiences of living unsheltered, they will really kind of talk about that as a motivating factor for not going back to that situation and moving forward. Also with looking forward, I like to call this kind of sometimes playing the movie to the end, right? If we continue on the current path or we continue in the current living situation with the current behaviors, what's likely to happen and where could that lead to? So what are some things that, could help with accomplishing these goals independently? What are the supports that you need in place to help you achieve the things we're discussing? Another thing that I like to kind of utilize that can be a good gauge for conversations with members is just the readiness to change ruler. So on a scale of 1 to 10, with 10 being 100% ready now, where would you say you are in relation to this change? So when we're talking about housing specifically, if somebody says that they're a 10, you've got your unit fees, you've got your moving costs, you have, boxes, you are 100% ready. You have made a plan, you are ready to execute the plan, you have taken steps to prepare for the plan. And if you're not a 10, how can we get you to a 10? What are those supports and things that you might need? And what again, are you willing to commit to and able to commit to doing now? Also, another big question here is just that level of support needed. What can I do as your provider, as your care manager to help you facilitate this change? And from here, Cliff's going to take us home, talk about some TYSR funds and other options. Cliff, I did see a note in the chat about what TYSR is specifically. So when you get there, you could just elaborate. That would be great.
Yeah, and I did answer, I think I did in the email thing in the chat. So rehousing workflow. So this will be sent out, and it's kind of what we're going over, and it's the process of like doing the rehousing flow. I'm not gonna read that because I can't see it real good. Stephanie, we changed it a little bit on me, which is okay. So initially, care management will be connecting with the provider or supportive housing. So when things happen, let's say and I'm gonna go a little off target, and I do that sometimes. We get connected, either the provider sees there's a tenancy issue or a property on notice to vacate, or it'll come through supportive housing team. So what we'll do is it gets connected, right? So care management will get pulled in, provider, and supportive housing. So kind of pulling together what's going on, trying to determine what's happening. I know previously or historically, it was always, let's go rehouse. We're not looking at that. That's not our first option. It's definitely not our first option. We can maintain housing because really, if you're looking at it, if we're able to submit a rehousing plan that's effective and efficient, the members engaged, we can save that housing. Our property managers aren't as quick to evict as people believe. Um, they're a lot less likely to evict. So with that, we really want to come together. If there's still barriers or there's some increased behavior concerns or some problems with property managers, so we have another team, which is the eviction prevention team, tenancy stabilization coordinators, so they can be referred for that. Reasonable accommodations. We have an individual that can assist with that within Alliance. So staffing's included, case consultations. I'm just going through a lot of different routes we need to be really looking at before jumping to rehouse and just move people on, because are we really addressing what the issues are? Are we just moving to another situation that's never been addressed? So we really want to dig on that. I mean, I can't say it repeatedly. So rehousing plans would be looked at that. If none of that was done and it's just a move, they're most likely going to be denied and questions will be asked. It doesn't mean it can't come back, but we really want to dig into that. So workflow would be the provider and the member and care management working on a rehousing plan on what's needed. Really the provider on what supports they're going to provide for the member. So it's not just the member, okay? So as providers, there's a system that you're supposed to be in place as well to support that member and what you're willing to do to provide those supports. So we're signing off on those, okay? So really looking at that, this is what you're going to be able to do or try to do to work with the members. And then the member agrees. Care management will manage that. So those are reviewed through that. They will come over. It gets reviewed by the care manager or transition coordinator supervisors to move forward. And then it'll come to supportive housing managers. And then they'll be reviewed and either approved or denied with information on why the denial was. From there, then it goes into the rehousing process. Really plan ahead. So that goes into the 40, if once you're approved, if you need if you're looking at targeted, get that targeted referral in, don't wait. Let's say someone was approved for July, don't wait till August to start looking for housing. It's going to take, at least 2 to 3 weeks, and that's fast, right? That's the reality. It's going to take 2 to 3 weeks, and that's a quick response. So we really don't want to wait. Trying to see what else I'm missing on there. I think that goes over everything pretty good with the workflow. You guys will also get that information. And next one. So financial request and rehousing. So if with TY, we'll go over TYSR rehousing funds request using newly developed TYSR rehousing and supportive housing community living. So that's through the approval. Care management would do that. So let's say someone those aren't automatic, okay? Those were never in place previously. They just started about 2 years ago because TYSR was initial. This is only for TCL too. Just an FYI, I think Eva asked that question. So with that care management would submit that for what is needed. It's not a certain amount. There is a limit, but it's specific on what the needs are. There's requirements to what is needed, like someone needs a bed, right? If they don't have a bed, possible microwave, certain things that individuals need moving into housing. Because this is rehousing, this isn't initial housing. So remember that. So there's different funds for that. Also, if someone's moving and they're just relocating, so they should bring their furniture with them. Okay. So then TYSR could be used for a moving cost for a mover. Those are funds that can be used for that. It's real important with that it's not going to be all new furniture. Okay. So the goal is to move. Now, let's say someone does have bed bugs. That would be a request for that for certain things. Okay. So just be aware of those. With TYSR for moving costs, it's one move. So it's not a move like, let's say they can't sign their lease, but they have to move out. So it's not to storage and then another moving cost from storage to the unit. Okay, so it's just one of them. Submit emergency funds for those requests, which kind of goes back into the bed bugs situation or things we don't want our members to bring into a new unit due to those restrictions. So there's different things, which also if there's utility costs, like there may be a debt from the previous unit. So we want to check on that too. When we rehouse, don't wait till that lease signing to find out there's a $400 electric bill. So think ahead, because that'll we don't want to move someone in without electric. So we really want to look at that. And it's the same as moving in with initial housing. When people move in initially, don't wait for that lease signing because they may have had a debt. And even if they weren't housed before, it may have been under their name. So we really want to make sure we're looking at those things early on so we can take care of those and the move-in is effective. It's really important when our individuals are moving into rehousing, be there with them, spend the time when they're rehousing, when they're moving in, help them set up their unit. I think, and I'm going to say this, prior to COVID, it was a wonderful thing. I feel like it's went away a little bit, and I think it needs to come back. We really need to spend the time with our members when they move in. It's an exciting time, and that's even for rehousing. Let's make it. They need to enjoy that, and they need the supports for that. because it's a lot. I mean, I know when I move in, I hate it. If I didn't have my wife, I'd go nuts. Um, those are things that, we need those supports for our members. And next one. So alternatives to rehousing. So there may be situations where members can't go straight into, let's say they're losing housing and they're getting evicted. So they're being placed out of the unit, and there may not be a rehousing plan approved yet. Um, there may be other reasons, but here's some options. So bridge housing and CTRP. So for them, we want a rehousing plan approved prior. We really, because that's a 90-day limit. So just be aware of those, but that is an option. Um, Oxford houses, sober living houses. If we have a member that is struggling with SUD, these are good to not, if they're still actively using and want to work on this, maybe these are alternatives to not rush, right? Let's get, let's make this effective. What's going to help and what's willing for our members? Where are they at? But these are options for this. Boarding houses and rooming houses. So those are options. I know when I was working as a provider, I used to have a ton of rooming houses that were, I know, and I understand it's hard for some of the rooming houses aren't the best places, but there are some good ones. Get to know them, um, see what's available for our members to try to prevent, being with the homelessness piece. Then that will help. And it also provides, us with providers working with the members while they're still living in a unit to work on that and then to work on things that they need to work on. Group living, 5600A group homes, a lot of times that may be the guardian's route. But those are routes that are options if people are struggling to live independently. And that's what's kind of been seen through high risk, where they're not approved for rehousing due to risk factors and needs higher level of support. And that may come up. So those, want to be looked at. I know within Alliance, it's going to be more towards the provider. So we don't really connect much on the housing team with group living. So we don't have a lot of those contacts, but we do have a, listing as well. Shelters are always options. We know they're not the best places. Our members, some don't, will go or have been in shelters, but those are an option. Living with natural supports, family and friends. Treatment plans that involve hospital stays if medical or behavioral needs persist. A member has become unstable, there's risk factors, where there's concern for safety. So we really want to work. There may be something that's an individual is working and we're seeing in housing, and this all starts to pan. We start to see what's going on. We want to look at that. We really want to get individuals to a safe place, to get stabilized, and if sometimes that may be needed with a hospital stay, and we need to work towards that. And I know we don't like to hear that piece, but that's the problem. That may be the best option for the safety issues. Return or admission to an adult care home, and that may occur. I know we don't want to ever try for that, but in some cases that may be the need due to medical needs. A lot of time, most likely, most of the reasoning. And next, and that is it. And this is our teams um, that we all work on. So it says the counties and who does what. Well, I don't think we're that specific. We won't go through that. But if you guys have questions, I really would love to hear questions because I know there's people on here that have questions, and we discuss these a lot. So please feel free.
Yes, I have a question.
Sure.
Just wanted to know, do y'all have a group home list as well or no?
I do have a group home listing for the state. I don't know how old. I think it's about a year old. Who asked that? I'm not sure who's on
Uh,
there.
my name is Jaleesa. I'm from Southlight Healthcare, and I was wondering, is there any possible way that I can get that list?
I got you, Jaleesa.
Thank you so much.
I would say they always have an updated list on NCDHHS website. You have to play with it to kind of get to the actual listing, but it will show you where you could go into mental health by counties, and right there it brings up each county and what group homes they have available from that listing and the contact information, and it updates pretty frequently, and it'll tell you the last time it was updated.
Thank you, Akira.
You're welcome.
I don't see any more questions in the chat, but feel free to come off mute and ask us anything. We are transitioning into our office hours at this time. And so if you do have any questions, even,